Hey everybody, Roger Levin here with your Practice Production Pearl of the Week. This is part 2 of the topic that I gave you 5 principles of in our last video, how to make your patients like you or how to not make your patients dislike you. And again, it all goes back to operational systems. This is what we focused on for the last 40 years, put into thousands and thousands of practices, and you can do this and it works. So I gave you the first 5 last time. I'm going to pick up with number 6 on how to make patients like your practice better. And number 6 is don't ignore them when they come in. Even in the best offices, we often see patients come in, nobody says hello, nobody says hi. Let me tell you, when that buzzer goes off in the morning, like a basketball game, buzz, the game begins, say to yourself, say to the whole staff, end your morning meeting with the words, "It's showtime." Now, showtime will be great if everybody knows what to do. You've got to train your team the same way we do to get your team to live showtime and know what to do. And one of the principles is we don't ignore patients when they walk in the door. Everybody wants to be important. Everybody wants to feel special, and you need to make that patient walking in the door feel that way. Number 7 is they leave late. They come in, they're in the appointment, they think they're getting out in 30 minutes or 45 minutes, and they're late. People don't like to be late anymore. That means a kid is waiting somewhere to be picked up. They're racing then to a grocery store to pick up food for dinner. Everything's behind. People get stressed. We know in hygiene, separate point, we know in hygiene that the longer it takes a dentist to get into the hygiene room, the lower the chance of case acceptance, because that patient is now thinking, I want to get out of here, not thinking about what the dentist is telling them that they need. Number 8 would be you take them late. Same concept, but a little different. They're not leaving late. You're starting late. They're sitting out there. Nobody's telling them what's happening. Levin Group teaches a concept. If you're more than 10 minutes late, you go out to the reception room, you apologize to the patient. Front desk does this, and you give them a $5 coffee card, gift card to Starbucks, and say, have a cup of coffee on us after you apologize and explain why you are running late. Number 9 goes back to what I said before. They're sitting in hygiene waiting for a doctor. Sometimes it can be 15 to 20 minutes. The hygienists hate this. They are frustrated by it, but this is not a team-based pearl this week. Your patients hate it. They're not going to like your office if they got to sit there waiting and waiting and waiting. People don't have the patience anymore. After they get finished scrolling through their phones, they are frustrated and they want to leave. We heard a story recently about a hygiene patient that got up and left, never paid the bill, and never came back. Not good. By the way, got my notes here for you because I want to do a really good job. And number 10, your patients don't like when they're surprised by the fees. Make sure you have the scripting to build value for every service. Make sure they see the service as bigger than just a filling or a crown or an implant. Relate it back to their health, their future, staying young, eating comfortably, keeping their teeth for a lifetime. But don't surprise them with the fees out of nowhere. Help them sense the value and then explain the fees. Nobody knows what your fees are, so it's always a bit of a surprise, except for hygiene that they're kind of used to. So make sure you build value, because they're sitting there thinking, okay, how much is this going to cost? Build value before you present fees. As always, I wish you increased practice production every year. You can do these things. You have to have great systems, and I'll see you next week.